Good afternoon. I'm Tasha Phillips-Wilson, recent medical graduate of St. George's University School of Medicine and current public health student at the University of Michigan. I am honored to be here today with Dr. LaPrincess Brewer. She is a preventative cardiologist and assistant professor of medicine at the Mayo Clinic, Department of Cardiovascular Medicine in Rochester, Minnesota. She's also a clinician scientist, health equity enthusiast, and community advocate. It's such an honor to be here with you today, Dr. Brewer.
Thank you so much for having me today.
Excellent. So I'd like to talk to Dr. Brewer. She is very active in her community, addressing health equity issues, especially heart health. And so, Dr. Brewer, can you talk to us a little bit about your faith program and your community heart health?
Yeah, so I am, as you said, a health equity enthusiast. I consider myself a community engaged specialist or interventionalist, and I am the founding director of a community-based participatory research program called FAITH. And every cardiovascular investigator has to have an acronym, right? So it stands for Fostering African American Improvement in Total Health. And we partner with local community-based organizations to promote heart health in underserved populations. And we have an emphasis on partnering with faith communities, including the Black church.
Excellent. And so I'm a member of a Black church, and I know the importance of patient trust as well as health literacy within these churches, and that is essential factors in improving these. Can you talk a little bit about your work in those areas?
Yes, I would say that my why for partnering with communities of faith, including the Black church, actually stems from my upbringing within the Black church. And I recognized early on, unfortunately, that so many of our congregation members were passing away prematurely from uncontrolled cardiovascular risk factors, things that could be prevented. So hypertension, diabetes, high cholesterol, leading to heart attacks and strokes. And there was so much potential loss early on. And these people that were part of my church were like family to me, although they weren't necessarily kin to me. So I carried that with me over time throughout my clinical training, that I wanted to give back to the community and allow and really promote health promotion so that these communities could live long, healthy lives. So this inspired me to become a physician scientist, a cardiovascular investigator focused on community engagement in underserved populations.
Excellent. And with this work, I know that you've seen some growth and some changes impact in the community. Can you share maybe a story that you've had or?
Yeah, so we, as a part of FAITH, we go out into the community and do health education. We also co-designed a mobile health intervention called the FAITH app with community partners. And through use of our app called the FAITH app, our community members had improvements in their overall cardiovascular health according to the American Heart Association's Life Simple 7 framework, which we now have updated to the Life's Essential 8. Shameless plug. So we improved cardiovascular health in underserved African Americans, and that their cardiovascular health scores improve from the poor range to the ideal range. And this has been shown to improve cardiovascular outcomes, including mortality. So we are improving long-term cardiovascular health and survival by partnering with communities to develop interventions that they have direct buy-in, that they're actually developing and co-informing and co-creating with our team. And I always like to share anecdotes as well. So with our FAITH app, one of the key features is a sharing board. And many of our participants had not known each other prior to joining our trial, but they were able to connect with people on the sharing board to actually go out into the community and practice health behaviors. So we had 2 single moms who wanted to become more active in their local gym, but they found it very intimidating. So they decided to go together, and they became accountability buddies and partners in going to the local YMCA, and they did very well in our program.
Awesome. It's excellent to hear. And often we can't do things by ourselves. So it's great to hear that you're encouraging partnership and community within your organization.
Thank you.
Also, yesterday I did see you at the Health Equity Hub while we were watching the clinical trial discussion. One of the panelists, Dr. Melvin Eccles, he's the leader of the Diversity, Equity, and Inclusion Committee for ACC. He mentioned that, yes, traditionally, churches as well as barbershops are great places to recruit African Americans for clinical trials, as well as to increase patient awareness. Can you talk to us? He also stated that, but it's not, there are other places. Can you discuss a little bit about places that we perhaps haven't tapped and that we should explore further?
Yes, Dr. Eccles is one of my health equity heroes, and I completely agree with him that there are other community-based organizations that we can partner with on our journey towards achieving health equity for all. So although my primary focus is working with African American churches within the faith community, we also partner with other community-based organizations, including the YMCA. Our primary community partner is a community health worker, and he has an entire cadre of community health workers that actually go out to the community to do community-based screenings in partnership with faith. So I also have, as a part of our clinical trial, embedded a community steering committee or community advisory board. And that is a diverse membership of members from representing several nonprofit community-based organizations as well. So I completely agree that there are other, areas that we can tap into.
Excellent. And lastly, Dr. Brewer, can you share with us a little bit of challenges about preventative cardiology, but then also share what perhaps might be your greatest joy and keeps you going?
So challenges in preventive cardiology, I must say that preventive cardiology involves not only management of clinical factors, so hypertension, blood pressure, cholesterol, weight management, it also involves healthy behaviors and lifestyle. And many of these are influenced by the social determinants of health. And that is a huge challenge, but really an opportunity, though, for us to really intervene on factors that really matter to our patients and truly influence their outcomes. So I'm really, really pleased to see here at ACC that health equity and the social determinants of health are becoming embedded in all that we do. And it's also embedded in all of our guidelines, including one that I was recently a part of, the management of chronic coronary disease. That we actually had an entire section on management of social determinants of health, which is now a class 1 recommendation for all cardiologists to screen and identify and provide resources to our patients. So I think that's, although it's a great challenge to address the social determinants of health, it's also, again, a wonderful opportunity for us to really impact population health.
And then what about your greatest joy in doing this work?
The patients. I love practicing as a clinical cardiologist. I learned so much from my patients, and I'm very privileged to have the opportunity not only to practice inpatient and outpatient medicine and cardiology, but also to go out into the community and promote cardiovascular health as well. I also consider it an honor and a privilege to be able to train the next generation of cardiologists and cardiovascular medicine practitioners through my practice as well, and that gives me joy.
Awesome. Thank you so much, Dr. Brewer, for doing this interview today for Fits on the Go.
My pleasure.
Awesome. It's been a pleasure as well. If you'd like to watch more videos like this, please check out youtube.com/FITsOnTheGo and follow us on Twitter, X, @FITsOnTheGo.